Actually, the self-assessment tool is a tool that we launched during the 23rd EHP Congress in Gothenburg in March 2018. And what the tool does is that it allows hospital pharmacists to assess the level of implementation within their hospitals. And you may be asking yourself, why should I assess my hospital with the tool? There are several reasons. First of all, the tool allows you to understand the level of implementation within your hospital. Secondly, the tool allows you to understand where your hospital is at within your country and within other member countries, because there is a feature in the tool that allows you to compare yourself with other hospitals. The tool also provides you with individualized action plans with evidence-based resources that will help you better understand the statements and also will give you a path to move towards implementation. And besides all of these, we do believe that it's very important that you assess your hospital with the assessment tool, because it will be a good starting point to start discussion with your colleagues within your hospital, and not only pharmacy colleagues, but also doctors, nurses, to really start a conversation around the statements and what your pharmacy and your other colleagues can do to really move towards implementation to, at the end, obtain better patients' outcomes.
Well, they started their life really in 2008. When FIP did some work looking at the future of hospital pharmacy. But that was at a global level. And what EHP decided to do was try to make those statements more relevant to hospital pharmacy practice in Europe. Unlike the FIP, EHP was going to involve patients and other healthcare professionals, doctors and nurses, to say what did they expect of hospital pharmacy. We involved more than 30 organisations from doctors and nurses, all of our own organisations that are members of EHP, and we used something called Delphi process to try to standardise the statements. And then the big event was a summit in 2014 held in Brussels, at which people voted on those statements, and we ended up with 44 statements.
So the implementation project started in 2016 when EHP decided to set up an implementation team. The first thing we did was to design a project plan with the help of our members. We organized several workshops and brainstorming sessions, and finally we put together a project plan that it was put up for a vote at the 46th General Assembly in Prague. Right away after the project plan was approved by our members, we started by setting up a network of implementation ambassadors. The national implementation ambassadors are a key part of our project because they act as primary link between EHP, the national associations, and the implementation activities that we're doing within their countries. We have also developed an awareness campaign, and actually the latest statement survey from 2018 has showed that the statements awareness has increased by 20% since the project started in 2016. Besides, we have also developed an online self-assessment tool that allows hospital pharmacists to assess the level of implementation within their hospitals. In addition to the tool, we have also developed a training program called the Statement Implementation Learning Collaborative Centers program, that we also call the SILCC program, that actually allows hospital pharmacists to visit hospitals from other member countries to receive training in procedures that are linked with the statements. So after taking all of these, what EHP is doing now, it's working with our network of ambassadors and with our members to really develop national implementation strategies that really meet our members' needs and our members' priorities.
EHP has always been about allowing for opportunities for hospital pharmacists to meet each other from different countries, to learn from each other. They'd always also wanted to sponsor people to visit other countries to do that. So with the statements, the SILCC program provided an opportunity for people to go to other hospitals and see something that they wanted to do. Take that back to their own hospital and learn from it.